and revisit at all times. So starting the presentations and posters, we invite to the stage Laura Ribeiro Oliveira. She's going to present this poster subject with respiratory allergy experience distinct adverse effects with COVID-19 vaccines.
Olá, bom dia a todos.
So, hello, good morning to you all. My name is Laura Oliveira. I am from the Federal University of Uberlândia, and I'm going to present my work, which is subjects with respiratory allergy experience distinct adverse effects with COVID-19 vaccines. So the respiratory allergy, they are triggered by inoffensive, unharmful, called aerosol allergens, and can make a severe reaction in some individuals and cause some symptoms such as rhinitis and asthma. These have happened with individuals that have the predisposition to these allergens. And with the tests to verify the positivity of these allergens are the predictive tests. In the beginning of the pandemics, there was a necessity of development of many vaccines, and these vaccines were applied nationally, were Pfizer with the RNA messenger technology, AstraZeneca with the retrovirus, and the CoronaVac vaccine, which the technology used was of a deactivated virus. So it had worked with 305 subjects, and they were recruited through social media and by television. And these studies were carried out in the Hospital das Clínicas of Uberlândia. The majority of these individuals have the first dose of the vaccine and the second vaccine as well, and they had reported taking the booster dose, which is the third one. We also applied the rhinitis and asthma questionnaires to evaluate the symptoms of these allergies, and also the skin prick test to assess the. And also we had the ELISA for the quantification of these allergens. We also evaluated adverse reaction post-vaccination through the quantity of adverse effects that they had. Our results shown that the majority of the subjects were atopic, presenting 54.4% of the individuals, and 45.6% were non-atopic ones. And these subjects, they presented allergies, respiratory allergies, such as asthma and rhinitis.
Os resultados apresentados, nós queremos analisar se a quantificação dos efeitos adversos
The quantification of adverse effects among the doses of vaccines, independently of the vaccines used, we can see on chart A that they presented having adverse reactions on the first and the third doses comparing to the second dose. On the shot B, on the chart B, we could evaluate the quantity of these effects, and you could see the AstraZeneca and Pfizer vaccines, which were shown major reactions compared to CoronaVac. On the second dose, we can see a behavior on Pfizer's vaccine, which presented more effects. And comparing to AstraZeneca and CoronaVac, and the third shot, there was no significant difference among the vaccines. Here we wanted to evaluate the quantity of adverse effects among the doses of the vaccine for each type of vaccine. So it's differentiated the type of vaccines. The first one is AstraZeneca, and it was able to trigger these effects in subjects that took the first doses compared to the second dose. We did not observe significant difference on the shot of Pfizer and also Coronavac. So seeing that the first dose triggered more adverse reactions, and we followed on our analysis, stratifying the atopic and non-atopic subjects, and we could observe that in atopic individuals that took the AstraZeneca vaccine, they had the more adverse reactions, such as muscle pain, fever, and shivers, comparing to the non-atopics that took the same kind of vaccine. These results suggest that these adverse effects can be related to atopic symptom condition, and these can be observed and new approaches should be carried out. Although they presented these adverse effects, they did not report it anaphylaxis or respiratory allergies. So we can say that safety of COVID vaccination, they are safe, especially for atopic subjects. This is my contact, and here are the researchers that works with us and also the collaborators. And I thank all the organizers. I'm very happy to be here. Thank you very much.